ovarian function begins to decline, unfortunately. The production of two key hormones, progesterone and testosterone, starts to drop. Yes, perimenopause can and should be treated. And restoring sex hormones with carefully dosed bioidentical therapies. If you're in your late 30s, early 40s, and you're feeling like you're losing yourself, perimenopause might be knocking on your door. Perimenopause is often called the zone of chaos, and for a good reason. For many women, this transition is even harder than menopause itself. I feel like when women know what to expect when we're in menopause, the vasomotor symptoms like hot flashes and night sweats, but when we experience perimenopause, it's kind of a gray area. The symptoms can be very vague, unpredictable, confusing, and incredibly frustrating. What makes it even worse, that so many women go to their doctors, explain that something feels off, and then too often they get answer that the symptoms are just aging, that the symptoms are normal for the age, or it's all in your head. But the truth is, your symptoms are real, and with the right approach, they can be absolutely relieved. You don't have to keep suffering the way you feel now. If your periods are all of a sudden changing and they become irregular, super heavy, if all of a sudden you can't sleep, you wake up in the middle of the night, if you are gaining weight despite diet and exercise, if nothing changed in your life, especially around the midsection, if you have mood swings, anxiety or depression, brain fog, if you feel fatigue, loss of motivation, low libido, vaginal dryness, if your hair is thinning out all of a sudden, and your skin gets dry, you may be in perimenopause. As both perimenopausal woman and a hormone provider who works with hundreds of women going through this stage, I can tell you, perimenopause can be absolutely brutal. And what's important to know that two women can both be in perimenopause and yet experience very different symptoms because they're actually in different phases of this transition. In today's video, I'm going to break down the two phases of perimenopause. I'll walk you through the clinical signs and clues that suggest that you may be in early perimenopause, and then I will talk about what actually shifts when you move into late perimenopause. I'm Elena Climov. I'm a certified nurse practitioner and an Institute of Functional Medicine certified provider. I specialize in women's health optimization and fertility. My mission is to empower women just like you with personalized root cause care that supports your unique journey, whether you're going through hormonal shifts, preparing for pregnancy, or reclaiming your energy and vitality. I feel so blessed to have the opportunity to help women in every state of their lives, and particularly in midlife, because I am also going through this transition personally, and I truly feel your pain and pain of my patients. If you live in Houston, Texas, and want to see me in clinic, I'll drop the link below so you can check if you can become a patient. Before we dive in, I'd love to hear from you in the comments. Have you ever felt frustrated, discouraged, or maybe even brushed off by your healthcare provider when you bring perimenopausal symptoms? If that's familiar, then this video is for you. All right, let's get started and talk about the difference between early and late perimenopause. Perimenopause is marked by gradual decline of ovarian function. The difference between early and late perimenopause is actually considered a clinical diagnosis. That means that it relies on the provider's judgment, looking at patterns in your symptoms and lab results rather than a single definitive test. It's not always perfect or 100% precise, unfortunately. When it comes to labs, there is no single lab test that can tell us for certain whether you're in early perimenopause, late perimenopause, or menopause itself. A lot of providers are actually against checking labs for perimenopausal patients, but I think labs have a role. In my clinical practice, I combine labs with symptoms to get the clearest understanding possible. There are a few biomarkers that clue me in if someone in perimenopause. They also help me determine the stage. As many of you know, I work with fertility patients, and I have a lot of patients over 40 who are trying to conceive. When I look at the fertility labs, I often diagnose them with early perimenopause. The three hormones that they'll look at are estradiol, follicle-stimulating hormone or FSH, and luteinizing hormone or LH. Ideally, if we're trying to achieve natural pregnancy, your FSH on day 3 of your cycle should be preferably below 15. In general, during early perimenopause, your FSH will be greater than 15, but still low compared to menopausal levels. And by low, I mean under 35. On somebody in menopause, the FSH can be over 50. I even saw it over 100. That's because the ovaries are no longer working and not sending the right signal to the brain. And the brain keeps sending a lot of follicle-stimulating hormone to keep ovaries going. But there is nothing else to keep. And then I look at LH or luteinizing hormone, the one that spikes right before ovulation and should be below, preferably 6, during the rest of the cycle. In perimenopausal women, this biomarker will slightly rise in tune with FSH. So slightly elevate FSH and LH clue me in about early perimenopause. I don't routinely test for progesterone in my perimenopausal patients unless they are trying to conceive. If you have symptoms of low progesterone and you are in your late 30s, you probably have low progesterone because you're not ovulating every single month, or the quality of that ovulation is suboptimal. This is one of the reasons why so many women trying to conceive in their late 30s and 40s may not be successful to achieve pregnancy. I actually have several videos on low progesterone if you want to check them out. Then estradiol levels. Estradiol levels can be all over the place. They can be low or they can be super high. In fact, it's common for perimenopausal women to have frank estrogen dominance due to overproduction of estradiol by the ovaries. It happens because women in early perimenopause may have several ovulations per cycle due to a phenomenon called luteal out of phase event, or loop event for short. It doesn't happen every single cycle, but it happens about 1 in 4 cycles in early perimenopause. So instead of a single LH surge that triggers one ovulation, you may have several LH surges strong enough to cause several ovulations through the months and excessively high levels of estrogen, leading to a condition called estrogen dominance. In the US, the average age when women reach menopause is around 52. It is a common misconception that perimenopause is the only few years before your periods stop. In reality, women can start experiencing symptoms up to 14 years before menopause and progress gradually. Many women describe it as feeling like I'm losing myself. I'm a prime example. I had 38, all of a sudden I was not sleeping in the second part of my cycle. Because I'm a hormone specialist, I knew right away that it's a sign of progesterone deficiency. I knew the root cause of my insomnia and treated it with progesterone supplementation instead of taking trazodone or Ambien that are unfortunately prescribed to many women like candies. We know that chronic use of these medications will lead to cognitive decline later in life. So instead of putting my perimenopausal women on dangerous pharmaceuticals, I always try to choose safe and natural options to help them with their symptoms. Some women believe that you can predict stage of perimenopause by age, and unfortunately, it's not true. Two women at the same age can be in two different states. Just to give you an example, I saw two perimenopausal patients yesterday in my clinic. One was at age 48, and she complained, I just don't feel myself like last few months. She said, my periods were regular until 2 months ago. It's the first time in my life I missed the period, and I'm not pregnant. And I confirmed it by negative serum HCG, which is pregnancy test. So I assumed that she is in early transition, but then when I checked her labs, her estradiol level was super low, to the point that I needed to start a an estradiol patch. Her estradiol was actually top notch when I checked her levels 9 months before, so she had pretty rapid decline of ovarian function in just 9 months, and her FSH and LH levels confirmed my suspicion. Then on the other hand, I saw a lady who was 50. She came to me experiencing profound menopausal symptoms. She had insomnia, night sweats, and she was constantly hot. She hasn't had her period for 3 months, so I was sure that she's in late transition and estrogen deficiency, which would explain her vasomotor symptoms. But when I checked for labs, her FSH and LH was mildly elevated, and her estradiol was beautiful. It was high, almost to the point of ovulating fertile 25 years old. She experienced symptoms of estrogen dominance. or having too much estrogen in relation to progesterone, she most likely had a loop event that led to several ovulations that finally resulted in having a luteal phase. That's why she had such a long interval between her periods. That explains her high estradiol levels and her symptoms. This patient is going through early perimenopause transition despite already being 80 years old. That's the hallmark of perimenopause. Hormones are still being made, but they're unpredictable, and your labs can be all over the place. Your symptoms matter far more than the numbers. So let's talk about what happens in early perimenopause. We determined that in early perimenopause, we still have a lot of estrogen, but you are just not feeling yourself. So what is going on here? As ovarian function begins to decline, unfortunately, the production of two key hormones, progesterone and testosterone, starts to drop. And with that shift, often we see symptoms like insomnia, worsening PMS, heavy or regular bleeding, loss of libido, brain fog, poor memory, difficulty concentrating, irritability, and others. As you move further into early perimenopause, your cycle itself may start to change. Periods often come close together, bleeding may get super heavy for several years, and then as you transition, they get lighter, and the overall flow tends to be shorter. You might notice part of like 21-day cycle, then 17 days, then 32, then back to 17 again, and can feel like your periods are like clumping together. Some periods are heavy still, but majority are getting lighter. So what can you do in early perimenopause? The first step is always education and awareness. I ask my patients to start tracking their cycles by the hog and journaling their symptoms so we can then establish the treatment plan together. Yes, perimenopause can and should be treated. As a functional medicine provider, I see great value in supplements over pharmaceuticals. If never your focus, I struggle. Adding a methylated B complex in the morning may help. For sleep and relaxation, magnesium glycinate at bedtime is often very effective. And remember, quality sleep is essential throughout the menopause transition. But you can only do so much with supplements. I tell my patients I cannot give you your hormones back without giving you hormones. We cannot restore, unfortunately, ovarian function with lifestyle and supplements. When hormone loss is driving symptoms, it makes sense to restore balance with bioidentical hormone replacement. This is the approach I take in my clinic here in the Woodlands, Texas. Instead of prescribing birth control pills or progestin-releasing IUDs, which use synthetic hormones and can carry unwanted side effects, I use functional medicine approach. That means supporting diet, lifestyle, adrenal health, thyroid balance when needed, and restoring sex hormones with carefully dosed bioidentical therapies. I replace all three hormones that women lose when their ovarian function decline, and that is estrogen, progesterone, and testosterone. Yes, you heard me right. I replace testosterone in women as well. I will have a separate video of testosterone replacement for women. A lot of my menopausal patients tell me, I thought I can tough it out and push it through, but I can't. The goal isn't pushing through this stage. It's to feel supported, optimized, and able to thrive. Because life in your 40s is so busy. Kids, work, and responsibilities. We don't have time to feel bad. As you move into late perimenopause, your cycles start to spread out. Periods may show up every 45 days, then stretch to every few months, and eventually 6 months apart. Sometimes women will go 10 or 11 months without bleeding, almost reaching a 1-year mark of menopause, only to have a period return unexpectedly. This back and forth can continue for years before menopause officially arrives. But once you reach exactly 12 months without a period, then you are officially in menopause. In late perimenopause, along with cycle changes, you'll often see symptoms that look a lot like menopause itself. Hot flushes, night sweats, vaginal dryness, which can make intimacy super uncomfortable. Hormonal fluctuations, sleep disturbances, like you can't sleep because you're drenched in sweat. You can fall asleep and then you can't stay in sleep. I call these symptoms of late perimenopause as hot and dry. It's important to know that it isn't always a neat step-by-step process. You can have late symptoms appear earlier and then early symptoms hang around later. So what can you do in late perimenopause? This is often the stage where hormone therapy can be especially effective. One of the big myths I hear is that you can't use hormones in late perimenopause because you haven't lost your period. And that simply isn't true. There are plenty of FDA-approved bioidentical estradiol products that can be initiated in late perimenopause to ease those terrible vasomotor symptoms. Talk to your provider. You don't have to wait until you lose your period to get relief. So that's a quick breakdown, or rather lengthy one, of early versus late perimenopause. If you'd like to go deeper, I have other videos and resources where I cover this topic in more detail. Be sure to subscribe as you don't miss my new videos every Friday. And I would love to hear from you. Leave a comment below and share. You're in early perimenopause, late perimenopause, or somewhere in between. What's been the hardest part of this transition for you? And if you are not sure whether your symptoms might be related to perimenopause, late or early, I've created a quiz on my website and I'll run the link below so you can check it out. Most importantly, please remember this: you are not alone in this journey.